statistically significant or clinically meaningful. What's the difference between them? And let me clear this misconception under 60 seconds. Let's start. So, statistical significance means that the result is unlikely due to chance. It's about numbers, like the p-value, the sample size, but that doesn't always mean that the result matters in real life. On the other side, the clinical significance asks, does this result help a patient? For example, does it improve survival, or does it improve the quality of life, or any symptom? A meta-analysis of randomized controlled trials published in BMJ in 2023 found that around 10% of oncology trials showed a clinical significant result, but they did not meet the threshold of clinical significance. For example, in some cancer drug trials, a new treatment might improve the progression-free survival by 2 weeks when compared with the standard of care, and the p-value would be 0.01. However, is this clinically significant? No. Is it statistically significant? Yes. So we need to look at the clinical significance, because having a statistical significance doesn't really mean anything if it can't be put into practice. But the real question here, can a result be clinically significant but not statistically significant? The answer is yes. And this can happen in underpowered studies where the sample size is small. For example, a cancer drug might show a 3-month improvement in the overall survival. However, the p-value is 0.07. So is this statistically significant? It's not, because it's above 0.05. But is it clinically significant? You can say yes, because a 3-month improvement in the overall survival for patients with advanced cancer is somehow important for them. This is called the SSCI disparity, which means statistically non-significant, clinically important, and this occurred in 30% of the trials in the same BMJ open study.